What other information exists, and what types of cancer have some degree of preventability?
About 30% of cancers are preventable, and the top on the list is cervical cancer, which is the second commonest cancer affecting women. So it's ironic that as much as it's preventable, it's the second commonest cancer in Nigeria. And as you said, there's a virus called human papilloma virus.
That's right.
That is transmitted sexually, and unfortunately for some women, it lasts longer on the cervix, as long as 10 to 15 years. And when that happens, it can lead to precancer, stage 0 cancer. So avoiding HPV, which is largely transmitted through sex, is number one. This particular virus also causes other cancers, like in homosexual men who engage in anal sex, they are predisposed to anal cancer. Okay. And for those who engage in oral sex, they are predisposed to head and neck cancers. So the second thing I would say is, unfortunately, breast cancer is not largely preventable, like cervical cancer, but one can reduce the risk by, maintaining a healthy weight, by reducing fat in the diet, by exercising regularly, by doing your screening. Once you're age 40, you should start your mammogram. So I'll just stop there. And of course, very importantly, HIV. HIV is common in Nigeria, and it is linked to some certain cancers like Kaposi sarcoma, non-Hodgkin's lymphoma. This type of cancers, their names are not known in the general public domain. Okay. But for those of us who are treating cancer patients, for every time we see a HIV patient, we are telling them to please use their medications properly, adhere to their screening guidelines so that their immunity is as high as it should, so they don't come down with these common cancers linked with HIV infection. For light-skinned people, because they have a low melanin level in their skin, as well as albinos.
I just leaned back like,
we encourage that, you should protect the skin, reduce the exposure to the sun, use sun protection factor in your cream, wear clothing that cover your skin, wear hats, sunglasses, just to reduce the harshness of the sun. So if you compare a Nigerian breast cancer patient to a Caucasian breast cancer patient, in Nigerian women, they're usually younger. They're usually at an advanced stage at the first time they noticed the disease. Their disease tends to divide very fast and tends to spread, and all this is linked to the genes. Same thing with colon cancer. These days, we're seeing colon cancer move from age 60 years old down to age 20, 30 years old.
Wow.
So some of the risk factors that we say cause colon cancer, for example, high diet in fat. Some youngsters who developed cancer at age 18 have not been exposed to all of these risk factors we're talking about. So the cause of cancer is still largely a mystery. Every day we're finding new answers, but we're still very far from putting a pin on what is the exact cause of cancer.